I'd like to thank everyone for joining us today for session number 5 of the weekly COVID-19 webinar. In addition to providing a weekly update, we will be answering questions that we received prior to this webinar, as well as, however time allows, we'll respond to questions we received during the webinar. So, as in the past, please feel free to submit your questions using the chat box. And with that said, we'll jump into the first question and I'll respond to that one. The question was, is there a way to register our staff that need to take the DMH medication aid certification online exam through our own Relias portal, or do they have to self-register through the link provided? The answer to that is the interim exam has to be taken through the MODD self-registration portal, as that allows the QE staff to be able to monitor the testing and ensure fidelity of the change process. So I know for some of you, it would be more convenient if that was in your own subportal, but in working with Relias, this was the only way that we could ensure the fidelity of the process. And with that, I'm going to turn it over to Val.
Thank you, Heike. Good morning, everyone. This is our 4th or 5th week for these calls. I can't even keep track anymore. Our 5th week for these calls. Thank you for continuing to join us. We're quickly approaching about 600 people on this call, and I know people will continue to dial in. I appreciate you taking the time to listen to us every week. Hopefully we continue to give you helpful information. It may not always be what you want to hear. It's not always what we want to hear either, and I want to make sure people understand that. Again, we continue to be proud and grateful for everybody out there that is working to fight this on the front lines and to keep individuals and your staff safe. I know it is hard to do, and that's why I hope getting data out to you is as helpful as it can be, at least to give you some situational awareness about what's coming your way. So with that, I'm going to start with some data right now. The state of Missouri, as of 2 o'clock yesterday, that's our reporting time, had 5,111 positive COVID cases in the state. There were 152 deaths. We've been talking about St. Louis County and City as the hot spot. The metro areas around St. Louis we've been monitoring as hot spots. That still continues. However, Jefferson County has now been elevated to a hot spot. There was a nursing home outbreak in that area, and the number of cases have dramatically increased. So wanted to make people aware of that. Other areas that we are monitoring right now, of course, Southeast Missouri, Scott County and Butler County have seen case increases. So we just want to make sure for situational awareness, people are remembering how important hand sanitation, environmental sanitation, and social distancing are. Also, Saline County, the Marshall area, also being monitored right now. And again, when we share that information, we're sharing it because it's a point that we can remind people about the importance of social distancing and the importance of environmental and hand sanitation. So that's really what we're hoping to do with the data. And the data helps us decide how we move forward. So we'll get into that a little bit more in a minute. Yesterday, Governor Parsons had a pretty large announcement. He extended Missouri's stay-at-home order through May 3rd and also started to announce his recovery plan for the state of Missouri. So I just kind of wanted to go over that and show how what we're doing and what we're working on, because a lot of this is stuff that we're working on dovetails into this opening plan. So the first part of his plan, Governor Parsons' plan, the first essential pillar is rapidly expand testing capacity and volume in the state, including testing for those who are currently contagious and those who have developed immunity to the virus. And we're looking at how can we expand testing for symptomatic folks as well as diagnostic testing for asymptomatic folks. And we are really trying to look at focusing on those highly vulnerable populations and the workers in those highly vulnerable populations. So I want to make sure you know that when we're looking at a testing strategy for the state, both of those pieces are key, the employees and the residents that we support. So we are included in that high priority bucket of testing capacity. With that said, testing capacity relies on a couple of things. It relies on labs that can do the testing, which Missouri does have plenty of lab capacity testing right now, but it also relies on test kits and the ability to actually collect the test so that the lab can do the actual evaluation of the test. So test kits, that it's like PPE, that seems to be our biggest challenge, and nationally that's the challenge is those testing kits. So we continue to work to identify better ways to get testing kits and get more testing kits out across the state. I know a lot of you are struggling. We as a state are struggling too in getting our employees tested and even getting some of the people we support tested. So please know that is a widespread and wide-heard need, and that's, I think, a big reason why it's one of the top pillars in Governor Parsons' reopening strategy. So we have a lot of people working on that right now. The second thing including in that, and it's something that we hear a lot and we're working on with you too, is expanding reserves of PPE by opening up public and private supply chains and also trying to utilize as many Missouri businesses as we can in that process. PPE access is very important, and we understand that, and we continue to try to identify PPE for folks. We actually just this week, for certain folks, all of our providers that are currently supporting individuals with positive tests, we have access to a very limited amount of PPE right now, so we started by reaching out to them to get some volume of what they needed so we can see if we can push anything that we have out. Then we also reached out to our group home providers, 5 or more people, because the more congregate your setting is, the harder it is to contain to contain. And so those are our 2 top priority areas right now. After we get through that, we'll open it up even more broadly, but I did want to share that right now. When I say we have limited PPE, we have some procedure masks, we have some hand sanitizer, and so that's all we've got. We also, I think today you'll see there are some small N95 masks that are available. They're only going to be available for a limited time, so if you get that email, please make sure you put in your order if you need small N95 masks. But that's where we're at in terms of what we've got in PPE. We do have some good news because there's more to PPE than just buying it. You can also extend the life of PPE. And so the state of Missouri is going to be, has access to a Battelle decontamination system. It's not here yet, but when we get that Battelle decontamination system up, we will be able to extend the lives of our N95 masks in this state, and that's really, really important. There's a lot of logistics with that about transportation and all of that's coming out. So it's a bright spot in the future, but it is down the road, and it will have its own challenges, just like everything has its challenges now. It's just nothing is easy, and I think you all can attest to that. The other thing that's important is healthcare access, and I just want to continue to drive home how important all of our folks in the healthcare system are, especially everybody that we have supporting people, and everything you do is important to this downstream healthcare system. And we continue, and the system continues to focus on that. I will tell you that I know it can get frustrating because all you hear about are hospitals and nursing homes. That's just because word count's limited, I think, really. They know it's bigger than that. So I want to make sure you guys know that. And that's a third part of Governor Parsons' Show Me Strong Recovery Plan, is to continue to monitor and, if necessary, expand hospital and the healthcare system capacity. You are the healthcare system capacity, so please don't forget that. The fourth pillar is, of course, improve ability to predict potential outbreaks using Missouri's public health data. And that's what we're hopefully already doing whenever we let you know about places that we see that seem to be ticking up in terms of cases. We know there's more than just the case count there. We know that the folks, individuals that work for us are also living with family members or have family members that work at these places where these outbreaks exist. We know that we all go to the same grocery stores, we all go to the same Walmart, we all use the same 2 gas stations. So that's why it's important to talk about hand sanitation and all of that kind of stuff. So just make sure when we tell you that stuff, I want to make sure you're thinking about it as broadly as we're trying to think about it, because that's how we contain this and that's how we get to the next step. And I know when you hear dates like reopening, we want to, lift the stay-at-home order on May 4th, that causes a lot of anxiety, and I understand that. One of the things that causes me anxiety too, one of the things that we're working on, or we'll start working on probably in the next week, is how are we going to, across all these state congregate living facilities, long-term care facilities, how do we start reopening those? What are the data needs we're going to have in place? What are the benchmarks we're going to have to see met before we will start not masking our staff anymore, and then allowing visitors to come in. All those things that are really, really important, and all of those things that we know people are really, really missing right now. When are we going to be able to start going out into the community and doing the things that, some things we used to do, and then eventually all things that we used to do. So those are things that we're going to be working on to try to figure out what do we need to see in our areas before we think it's a good idea to re-enter society. And so we will make sure as we figure those out, we share those with you and then work with you to try to figure out also what works best for you. But I agree that does bring anxiety. And that actually was one of the questions that we got in on our frequently asked questions request. So we really appreciate that. Another question I wanted to address, there are two specific PPE questions. The first question is, we did send out a request for PPE. Like I said, we do have limited access to some hand sanitizer and some masks. And so we sent that out to our positive providers and our providers with group homes to see what their needs were. Please do respond to that need. You're likely going to have to come to Fulton to pick that up, but we need to know quantities, not just that you need it, but it's really important that you tell us how much you need, because like I said, we have a limited supply, and that's kind of how we're trying. I mean, we do not want anything sitting in a warehouse anywhere. We want it out being used. So when we ask you for that, we really need to know what quantity you need as well. And then as we continue to kind of work through those high-risk areas, we'll continue to see what we have left and what we can also continue to push out. So just pay attention to that, but make sure you respond with quantity needed. And when you're thinking about quantity needed, please make sure you're looking at that PPE guidance we've issued about reuse of PPE. And we know that it's really hard to reuse PPE with some of the individuals that we support, but the more we can educate and train on that, the longer we will have these resources available to us. I know another PPE question we get, because we have this exact same problem, and I agree, we're all very savvy around masks and hand sanitizer and gloves, but gowns, there are no gowns. That's where we're at. I know that Missouri Vocational Enterprises is going to eventually shift to making gowns. I'm not sure where they're at with that right now. They were really pushing face masks because they needed enough face masks for all the prisons too. So their next step is gowns, and we continue to work with Missouri Vocational Enterprises to see how what our PPE needs are and how they can help us fill those. But you can get creative on gowns too. I mean, tie-back suits, anything that you can use is rain ponchos. That's what Wendy just wrote on a piece of paper and showed me. Get creative, wash it, reuse it, just anything you can come up with right now. And we've sent out a cheat sheet for PPE on things that you can use, and Google it. If you come up with good ideas, send them back to us, because everybody's looking. But gowns are definitely a statewide shortage. So I don't feel like you're not getting any. Nobody is getting any right now. I think the last thing I want to talk about today really is the financial picture for the state. And it's not clear, and it's really unknown. And as somebody who used to work in the budget office and had to try to figure out how much money we're going to have and when we're actually going to have that cash on hand, it is an incredibly difficult thing to do. And so I know that right now we don't have an ability to make retainer payments to providers. We continue to educate and help people understand the importance of that and the value of that. But please also understand that when you have this kind of economic uncertainty, and it's uncertainty because we don't know how long it's going to last. It's uncertain because we don't have, there's no way to compare this to anything else. And when you're trying to figure out how much money the state has to spend, it is very, very difficult. So I do think please pay attention to those financial discussions for the state. Please pay attention to those federal financial discussions too. I know that both the state Medicaid directors, my national association, the State Aging National Association, and I'm sure there are many, many others that I'm not aware of, have submitted a request to Congress to do a 12% FMAP bump instead of the 6.2% FMAP bump that we have today. And like we've talked about a lot, those FMAP bumps allow the federal government to push money to states quickly to help shore up where we have got other revenue shortages. So just please pay attention to that financial situation. It is real. There's you can't project or predict. So, but know that we continue to educate folks on how important all of our downstream providers are, as well as their financial position and the needs that they have. And I know you guys are spending money on PPE. I know you are spending money on overtime. I know you are spending money on hazard pay, and we continue to communicate that as well. So I think I've covered all of my items. So with that, I am going to turn it over to Wendy.
Good morning, everybody. I'm going to take some of the questions to get a little more into the weeds, and I want to thank you guys for your questions and letting us know where our guidance might not be as clear, or where there's confusing points in there, so that we can continue to improve on our communication out to you. So keep those questions coming. We need you to review that and send that in to us so that we can get you clear guidance, and we can also get our state staff clear guidance so they can give you better technical assistance. So we had some changes with this last posting and the Appendix K with family caregivers. So I know that it's a little confusing. So start with at the beginning with, if it is currently allowed in the current waiver application, it is still allowed. It is still okay to do that. So if you're a family member, you can be a paid caregiver. But what has changed from our original guidance is we originally wanted to create more flexibility and allow guardians to also be paid caregivers. That did not end up in the final Appendix K, and so now we need to realign to what is in the Appendix K. So currently, as of the 15th, or the date of that guidance that came out, which I think was the 15th, we can no longer pay guardians or legally responsible parties as caregivers. If you are a family member and you are not a guardian or a legally responsible party, you can continue to get paid. So if you are in one of those situations, or you've got families in one of those situations where it is a paid caregiver, work with your regional office, work with your provider relations staff to look for alternatives for yourself. Is there somebody else in the home that is not a paid caregiver, or is not a guardian that could be a paid caregiver, or there are other alternatives? So please work with your PR team to look at other alternatives. If there continue to be questions or confusion around that, please keep the questions coming into the DD mail. There's also some questions about the transition guidance from ISLs and group homes into an alternate setting. So if you're moving from one of those settings and going to go home to stay with family, or to stay with one of your caregivers in their home during this time of emergency, we had originally, what we have in the guidance now is only specifying employees or contracting with a provider agency for shared living. And that's really because that was the only service where we had independent contractors as an option for that service. So thank you for pointing that out to us in the guidance. We're going to take that into consideration and see if there's any reason why we can't allow the contracted employees in the other settings. And so we will let you know if we update that guidance in there, so we appreciate that. Out-of-home respite is a new topic that we talked about in the Appendix K, and we kind of expanded the settings where out-of-home respite can be paid. And we know that there's still questions around that, and we have additional guidance that we expect to be releasing at the end of the day. So I will give you what we know, but we don't have all the pieces finalized yet. We are looking at it being a daily rate. And so I guess that the rate part is what we still have to finalize. I'm sorry. There's another question about, does the out-of-home respite rate satisfy minimum wage requirements? Since it is a daily rate, it's going to depend upon how the provider sets up that service and how many support hours are required. For instance, if there's only one person in the home that can provide the service, then overtime will look different than if there's 3 people or 2 people that can provide the coverage. And it will also be different based on the number of hours of support the person needs. So I can't really be more specific than that in terms of, I think that is just going to be how the providers are going to have to look at that. There was a question about telehealth. Will telehealth services be allowable for rehabilitation after the COVID-19 crisis has subsided. People have found there to be a great benefit for some individuals and how they're using it with rehabilitation as a way to get by barriers when people can't come to program because of transportation, health, or other reasons, and they can still reach out and stay connected. I can tell you that we are going to look back on everything that we are doing during this time and identifying all good practices that have come into place in that and look at ways that it makes sense to continue them. So that's one of the things I think with all the stress and the strife and the bad things that feel to be happening during this time, we also recognize that there's a lot of good things that are happening and people are being very creative and innovative, and we love that. And so we want to learn from those experiences and what you people are doing out there and take advantage of that and spread that good practice around. So if there are good things that we're doing now that make sense to continue, we certainly want to do that, and we'll look at all of those things. Lastly, for me, I got feedback this week that we've not been as clear or transparent about the contract with Station MD and the future plans with that program. So my apologies if our communication has not been clear enough. Our current contract with Station MD is through the end of August. Our immediate concern and the intent with this contract was to provide our population an alternative to going to the ER for evaluation or leaving staff in the homes with impossible decisions to make. So we need to keep people home and out of hospitals and out of ERs to contain the spread. So prior to the pandemic, however, we were working with UMKC and the Institute for Human Development with the goal of being able to demonstrate the value of the service, not just for our populations through increased healthcare access and improved health outcomes, but benefits for the entire healthcare system. IHD is using this contract period to do a return on investment study, and the division is looking for funding mechanisms because we believe this is a valuable service, and we hope to be able to continue it beyond August or the state of emergency. But in the current economic environment, nothing can be certain. So the return on investment, it will be a critical piece of information for us to be able to make the case to continue that, and I hope that that helps to provide some clarification and transparency into what our thinking is currently and going forward. So we also have, well, Kim's going to talk about the survey, so I'm not going to step on her. So I'm going to let Gary take over and talk about the rollout.
Okay. So speaking of Station MD, the first 5,000 went active this week, and I know they're already getting some calls on that, and we're going to roll up another 5,000 in the coming week. So we do get some questions about people wanting to know if and when they're enrolled. So for individuals served by a residential provider, that's ISL, group home, or shared living, Station MD and the division are working through the provider to get information out to individuals and their families. So you're going to hear from your residential provider. For individuals living at home or with family, we're working through the support coordinator or trying to directly contact families directly as well. And the UMKC, University of Missouri Kansas City, is leading that effort, so you may hear from them. So going on, so corrected billing. So right now, service plans are pretty fluid, and providers may bill for services that need to be corrected in a future month. If something's switched from ISL to out-of-home respite, for instance, or from day hab to something else, you may have billed one service knowing that's going to be corrected and be billed as something else, or that the rate may change. So we've been working with the regional offices and doing some instructions with them and trying to ensure that we're careful not to recoup funds without having the corrected money on the same claim. So we don't want to create unnecessary accounts receivables and waiver services due to corrections that need to be made. So we are watching that. We had a question about out-of-home respite. If it's not on their contract, will this be added? So we're going to set up an out-of-home respite code with a separate modifier so we can track these exceptions. So we'll need to add that to all these situations and where out-of-home respite's being used to shelter somewhere. So yes, that'll be part of the process. So it's going to be a different rate. So we'll have to add that in every situation, and it doesn't take long to do that. So I don't really see that as an issue.
Contract.
Yes, it'll have to be added to your contract. And then And so there was some information came out this week from Social Security Administration. So the coronavirus relief payments to SSDI recipients. So SSA put out some information that you will not have to file a tax return to receive the stimulus check. And so also, we looked up some additional information on the SSA website that the $1,200 relief payment will not be counted as income and will be excluded from your resources for up to 12 months. So a place to get some information about the relief payments and SSDI beneficiaries is at ssa.gov/coronavirus website. But we're going to post that information along with those links on our COVID webpage, so it'll be out there. And with that, I will turn it over to Kim.
Thanks, Gary. Just a few quick updates. Wanted to share the regional office QERNs are going to be supporting individuals that are receiving HCBS residential services that have tested positive for COVID-19 and their service providers. They'll be supporting through communicating and sharing current risk mitigation information and assisting agencies and individuals with efforts to identify needs to support them at this time. Some of those examples Val alluded to earlier. So as we become aware of certain types of PPE or additional infection control products, the nurses will be reaching out to our providers directly and through the individuals as well to support how we can assist you with getting those necessary vital resources. Another thing that I wanted to share and stress is the importance right now of individual emergency backup planning. I'd like to encourage individuals on the call who are receiving HCBS services and supports, as well as your caregivers and your service agencies, to please be thinking about and developing your emergency backup plans if you've not already done so. It's a really important activity because it can assist you to identify what additional services and supports that you may need right now in the event that you would need to quarantine or isolate related to this COVID-19 pandemic, or if there's a potential change in your current support system due to COVID-19. Also, please be considering ongoing the access to technology to support being connected to your caregivers, your friends and family is also so vitally important. Please be looking this week as well. We're going to be sending out some additional revisions to our initial and recertification memorandum regarding CPR, first aid, and our DMH Med-Aid processes. One of the things that will be really highlighted within the revision is that we're going to include information regarding how you can currently access the DMH Med-Aid curricula for instructors and students at this time. And then lastly, there's been some discussion this morning around Station MD. We did develop a technology survey that has been sent out to our first 5,000 residential service providers to identify additional technology needs that can enhance the Station MD service. I want to emphasize that to utilize the Station MD service, you need a phone. That's the core component of being able to utilize the service. There are some other technology advancements that can support and enhance the service if you have additional risk for certain chronic conditions such as respiratory issues, et cetera. And so we're wanting to collect and gather information from participants to make sure that we have a good snapshot of what some of those resources that may be needed are, so that we can continue to partner with other agencies to explore options to support those efforts. So if you are a current waiver participant, as Gary mentioned, and you will be coming in through one of those phases of enrollment and then opting to actually utilize the service, please be looking for that survey request as well. It's vitally important that we receive that information to you in regards to what those additional needs might be to enhance that service. At this time, I'll go ahead and turn it over to Angie to provide some updates around the federal programs unit.
Hey, good morning, everyone. I just want to reiterate what everyone else has said. Thank you so much for all that you're doing on the ground. We appreciate it, and the feedback that you're giving us and the questions you're giving us is really helping us to lay things out going forward. So we have received a few questions on my end. Spin down is a topic that's been coming up. So we have reached out to our Medicaid eligibility specialist and as well as Family Support Division. So for the spin down requirements during the COVID period, we received some guidance. Beginning with March 2020 and any months after during the time of COVID emergency, if the spin down is met, if a person's spin down is met with their bills for medical services for which the client, the Medicaid waiver participant, is personally responsible for, or that are billed to DMH, or if the individual submits their spend down with a check, money order, or cashier's check, Family Support Division will extend their coverage without having to meet the spend down again during the COVID emergency period. Coverage will begin with the first month the spend down is met, and it will continue each month with no end date while the emergency is in place. If the waiver participant is enrolled in automatic withdrawal, those payments will continue to come out each month. So what the client can do is to opt out of those automatic payments, but then once the emergency ends, they will have to re-enroll again for the automatic withdrawal. So a couple of examples to help us understand that is that we're going to say that Sally meets her spend down using bills on March 12th. Family Support Division will enter those bills for March, and then at the first of each month, they will manually enter that the spend down was met with the bills throughout that emergency period. A second example would be Wally, who might be enrolled with automatic withdrawals. He automatically pays his spend down for March, which would meet the April spend down, and then April, which meets the May spend down, and he cancels his automatic withdrawal in late April. His spend down will be considered met beginning in May and extending for the duration of the emergency. And again, he would need to fill out the paperwork to re-enroll once the emergency is over. He may need, once he re-enrolls with the auto payments, he may need to pay in with a check while that auto enrollment is set up. It usually just takes that 1 month period. And we also, just in case you haven't seen it, but our DMH Medicaid eligibility specialists have set up a web page that includes all the COVID information from Family Support Division, and they have an FAQ document, and that you can find at dmh.mo.gov/Medicaid eligibility. But if you go to the DMH webpage, you'll be able to find the Medicaid eligibility site as well. So they do keep that updated, so it's a really good reference. As you're getting more questions, we'll continue to field those with our Medicaid eligibility specialist and Family Support Division and get those responses to you as quick as we can. Another question that we received was if state plan in-home nursing services are available to provide care for clients who are COVID positive. So basically for those clients that live in their own homes, not receiving residential but don't have family support. So I did work with MoHealthNet, and for DD waiver participants, state plan in-home nursing services may be provided through private duty nursing programs for children and for adults if that adult had a documented nursing need prior to the age of 21, and also through their home health program. These are services that can be accessed today for any other nursing need that would be provided through state plan. So nursing services through these programs are not dependent on a specific diagnosis, but they're based on the medical need and the eligibility criteria. And they will continue, the services through the programs continue to be available to participants who meet that program criteria. So definitely, if you're a support coordinator or provider for someone that's not receiving residential and you know that they're needing assistance with nursing, please help them get connected to those state plan. The support coordinator can help them get connected to those state plan nursing services. Another request that we have been asked to look at is expanding or broadening the definition of rehabilitation when provided through telehealth to consult and support family members as the provider is working to assist with engaging, activity planning, and helping with any support that would go on through that rehabilitation through the telehealth. So that is something that the division is looking at right now. We're looking to see if that is something that is really could already be provided through the current definition, or whether or not we would have to send another Appendix K submission for that. But we will keep you posted on that. So, and that's all the updates I have for today. But I do, again, thank you for everything that you're sending in and all the work that you're doing.
All right, thank you, Angie. Couple things before we conclude today. I know I heard earlier this week somebody wanted to hear some information about how we're transitioning someone who was positive back into our universe. And I thought I was going to be able to talk about that this week, but unfortunately I am not. And I'll just give you the whole story here. We do have an individual that, we have more than one individual, but this one has been in isolation on one of our habilitation center campuses now for the amount of time. He was his 7 days, no symptom. He was 3 days, no fever. So we were starting to do our 2 negative tests on him so that we could get him back into his home and out of isolation. And we got 1 negative test and we got 1 positive test. So now we're back to getting 2 negative tests 24 hours apart. So I was really hoping I was going to tell you that but this takes time. And I think if you're following anything on this across just even the regular news, it just takes time to get those 2 negative tests back in. On our staff side, we have not been able to, at least in our facility side, had anybody yet that was positive that we've been able to reintegrate into our workforce. But at this time, we're still looking at a 2 negative testing strategy for those folks too before we can get them back into the workforce. So, and across state government, that I think we've only identified 1 person that we've actually been able to get back into the congregate setting type workforce. So just know though, that's not because we're not going to be able to. We're still just new in this process, but we are working through the process to get people that did test positive back into the flow of our workflow in terms of that congregate living side, and that's all I'm talking about here. The second thing, we did get a question that came in about the PPE, personal protective equipment pecking order. And so the state's pecking order for PPE are hospitals are first, EMS is second, and long-term care is third. And we do fall under that long-term care category. So, I mean, we're as high as we can possibly be in terms of accessing PPE. I know you guys are aware that there's still a lot of limitations around what's available, even for the hospitals. So that's why PPE is a big part of our ability to reopen Missouri, so to speak. Another thing I wanted to point out, we did get several very specific family caregiver questions in, and we appreciate those questions. We're not going to answer those right now, but we will get answers back to you as soon as possible. There's a lot of nuances to that. Some of them cross over a little bit, and I don't want to give conflicting information. So we will work on those and get back to you on those, as well as all the other questions we haven't answered that came in. And then finally, I just want to remind everybody that the regional offices are here to help you. We have staff, they know how to get a hold of other folks, even in other agencies. If you need technical support with anything, I mean, if you're having a hard time supporting someone, please reach out to your regional office and we can help you. If it's determined that you just are not capable of delivering that support, we can help you, okay? I don't want anybody to feel like they're drowning here. I mean, more than we already are. But please let us know where you're struggling so we can try to figure some things out. There's a lot of stuff on food stability going on at the state level right now. We haven't heard a lot from folks around that, but as that may become a bigger issue, I don't know. Please make sure you reach out to us so that we can help work through those issues across the state. So I just wanted to make sure people did not forget those. While there may not be very many people in the office, they are all available to talk to you and answer your questions. So please don't forget, I know you've got excellent relationships with them. I know they have excellent relationships with you, so we want to keep that chain of communication open. That is all I had. Does anybody else in the room have anything, Gary or Wendy?
I would just mention one thing that you'll be getting more information on, but one thing that the division is working with our partners at DHSS and MoHealthNet and Children's Division is standing up and organizing emergency shelters for folks that may be displaced because of the COVID-19. Maybe family members are impacted, or there might be providers or family members who need support to quarantine somebody that's coming out of the hospital. So we are working with our partners to stand that up. If you are one of our partners on the phone, one of our providers that has space or has staff that aren't fully being utilized right now, that you can contribute to the effort, and you haven't responded to a survey yet, please let us know. You can email me, or you can email your regional office provider relations team. That would be fine, and they will get the information to us. So thank you for any support you can offer, and we will look forward to talking with you next week.
Yep. Again, just remind remind everybody that's working for you, because I will tell you every position is key right now. I know that your personnel folks are struggling through understanding all of the changes in the personnel world. I know that your families are your folks that make sure that families are connected and people are connected are struggling because what you've been trained to do is not what you're being able to do right now. And then I know that our direct care workers are struggling because it is a trudge at home and it's a trudge at work, and it's taxing. So just thank you for keeping people motivated. I am seeing some really fun stuff around how you guys are keeping people motivated. And for the families and individuals on this call, you know, thank you for bearing with us and also for cheering everybody on. So thank you. We'll be back in touch next week, and more things will get pushed out, and continue to fight with us. Thanks. Bye.